Hello, welcome everyone. Thank you for being here. I'm Sofia Gruskin and I direct the USC Institute on Inequalities in Global Health. And it's my pleasure to welcome you to today's panel, Advancing Sexual and Reproductive Health and Rights, Moving Forward Post the 2024 US Election. You know, last year in the lead up to the presidential election, like many people, I pretty much took every public moment to focus on the fact that in 2024, there were going to be 64 major elections, that approximately 49% of the global population was going to be voting. And many of us cautioned that this meant that in this year, 2025, our world could look really different. In the positive, countries could turn to new and more just ways of organizing themselves or fall into devastating patterns of regression and repression. And I think it's fair to say we're all deeply saddened by where we are. I think we've been shown in record time the power that existing and incoming politicians hold to shape laws, policies, and norms that impact all aspects of sexual and reproductive health and rights within their own countries, but also beyond. And, you know, we all know that sexual and reproductive health and rights is increasingly weaponized and politicized in our countries and in global spaces like the Commission on the Status of Women, but all with damaging implications for the health of communities everywhere. And, you know, we've been seeing these rollbacks in SRHR on every continent and on the global level for quite a while. And all of that has been threatening already hard-won progress. But then there's what happened since January 20th. And since taking office, the White House has released 89 executive orders. I just checked this morning, but that number keeps growing. But a surprising number of which put words and direction to the anti-rights and anti-gender movements we've been seeing growing across the globe in the last few years. So of particular relevance to our discussion here, these orders include the order to restore biological truth in the federal government by protecting men and women as biologically distinct sexes, and the complete reevaluation of all U.S. foreign aid. But there's also the fact that the language that we use to discuss the rights and health of people is flat out being banned. Words like gender, gender equality, gender equity, transgender, abortion, reproductive health are being scrubbed from databases and from the literature. And we all know this is about far more than the removal of language and the removal of databases. It's about halting research. It's about denying access to needed care and services. And if I can say it, it's seeking to deny even the very existence of millions of people around the globe. Now, much of this is being legally challenged, but the reality is that these cases are going to take a long time. And the long-term harm to people's lives, no matter what the outcome of these suits, cannot be overstated. So what does this all mean for sexual and reproductive health and rights globally? Well, clearly we have a lot to discuss today. And with that, and I want to note, I'm not going to do justice to anyone. Let me introduce our panelists really briefly. And I do ask you please to look at full bios on the Humanitics website if you don't already know these amazing people, because all of them are fabulous. So let me start with Sakai Chikawero, who serves as Gender Health Vice President of Programs, where she's responsible for advancing the organization's program strategy and country operations to achieve global impact. Her work history is incredibly deep, but let me just highlight that she brings 30 years of program management experience in global health and multi-sectoral interventions. Let me move now to Francine Coiteau, who's worked for over 40 years to promote comprehensive reproductive health services, including abortion around the world, including here within the US. And of the many amazing things that she's done, in 2018, she co-founded Plan C, a campaign that shines a light on the over-medicalization and restrictions around abortion pills and advocates for a safe, effective, self-managed option. Esther Kishmodi is an international human rights lawyer and chief executive of Sexual and Reproductive Health Matters. She too brings incredible experience, and I'm only going to say that she's an executive committee member and co-chair of the Sexual Rights Committee of the World Association for Sexual Health and a member of the WHO Transgender Guideline Development Group. And last but not least, Mitchell Warren has been the executive director of AVAC since 2004. Mitchell also brings phenomenal history and work around SRHR to this conversation. He leads the organization's overall program strategy and strategic partnerships around the world. And it's worth noting here that AVAC is the lead plaintiff in one of the two cases against the new US administration to restart foreign assistance. So you can see what an amazing group. Just a quick reminder, everyone, please use the Q&A function. I will absolutely try to get to your questions. And with that, let me begin. And I just, again, thank you all so much for being here. And just to say, you represent very different kinds of institutions, but the collective wisdom of this group in terms of the different ways you engage with sexual reproductive health and rights, you've all seen so much. So to start us off and to orient, I guess the question I want to ask you is, what area of sexual and reproductive health and rights is of specific concern to you and to the communities that you work with? What were your initial reactions to the flurry of executive decisions? Anything better or worse than you expected? What about now? I guess what in big is most of concern? And Francine, maybe can I start with you?
Thank you, Sophia. Oh, what to say about the US right now? It's all egregious. It's interesting because they have laid out their plan in this 2025 document that really basically brags about the approach, which is to attack everything, take everything out. And I think that in a way speaks the confusion, the chaos, the actually kind of frozen, the fact that we're frozen and trying to figure out what to do against all of this is based on the fact that many of us, I know all of us who are talking here today have always understood that this was multi-sectoral, multi everything, that we have to be working together, that human rights.
You're back. We were losing.
You want to go to? I'm so sorry. I don't.
Yeah, if you don't mind, I'm so sorry. So Sakai, may I turn to you?
Thank you, Sophia. Good morning and good afternoon, everyone, and thank you for having me. First, I want to pay tribute to women, girls, and the communities that are at the center of the work that we do, and not forgetting colleagues, thousands of them, who lost the opportunity to do the work that we all love doing. And gender health is internationally recognized for our expertise and impact in the area of sexual and reproductive health and rights, including maternal and child health, contraceptive care, gender-based violence prevention, and ensuring clinical quality in these technical areas. We care about who and what we do with and who we partner with and how. Our programs are designed to address harmful gender norms, increasing meaningful youth participation, and we strengthen health systems around the world, which is all critical to achieving universal health care. We champion integrated and quality SRHR programs globally in collaboration with host governments, the ministries of health, youth and women-led organizations, individuals with multiple vulnerabilities, and other implementing partners and stakeholders. For example, in Burundi, for over 10 years now, we've been partnering a local women-led organization to address harmful social norms that perpetuate gender-based violence, that aids in the spread of HIV among women and children. Through partnership with this local organization, and gender health could take our work to scale, but it's no longer possible because the project was terminated. We always built in sustainability of our interventions from the design stage. We are most concerned with the abruptness with which projects were suspended and eventually terminated without warning. It is difficult for us to make sense of it all, or to break it down to our staff or to our partners or to the host governments that we work with when we have very little information ourselves. No preparation of any type for crisis management could prepare us for this experience. Our projects all our USAID projects were terminated. Initially, when they were suspended, we were in disbelief because we knew the life-saving activities we had for maternal and child health were critical, and they were underway in several countries, including Ethiopia, India, Mali, and Senegal. They were stopped midway, just like that. When the window for waivers was opened, it raised our hopes. We thought we were going to recover some of the work. All our prime awards were terminated. Through the waiver period, still with our hopes high, they were dashed quickly because those waivers were not approved. So it soon turned into horror and despair upon learning that these were complete terminations and we needed to take action to lay off staff and close projects. The gains that we made in the last 30 years, they are so important for us to turn back on, but here we are. One of our major donors made a decision that had a lasting impact on our organization and our partners. Thank you.
Thank you. Thank you. Mitchell, do you want to take it from there?
Sure, let me go off mute. Thank you so much. And let me just say, first and foremost, Sophia, to you, thank you for bringing us together. I think one of the things that it's impossible not to think about, I think all of us, is being in community has never been more important. And we all know that. We've known that for as long as any of us have been in this work. But I think now more than ever, recognizing no matter where we live, no matter what work we do, no matter which aspect of the SRHR agenda we cover, if we don't engage and connect and plan, the opposition wins. And it's easy to get very paralyzed, I think, in this moment. I think we all, as you started the question, we all knew that these 4 years would be difficult, to say the least. And I think many of us read with horror Project 2025. We knew this was the playbook, even though it was denied. I think for me, though, what is most appalling is we knew where they wanted to get over 4 years. So I don't think what they're doing should surprise any of us. I do think that the speed and scale and inhumanity of it, though, is actually even more remarkable than I would have thought. What they've been able to do in 6 weeks, I thought it would take them a little longer. So maybe they're just a lot smarter than we thought they were, or a lot crueler, or both. And I think it is, I think for me, one of the challenges, and most of my work now, as you know, Sophia, is, and with you and many others, is around HIV and AIDS, but its relationship to the larger SRHR agenda. And if it were any one issue, if this were just about HIV, or just about sexual and reproductive health, or just about foreign assistance, or fill in the blank, just about any one thing, it would be shocking, horrifying, difficult. But the fact that, and again, we won't have nearly enough time to go through it all, the fact that this touches on every aspect, not only of American life and livelihood, but globally, is to state the obvious, devastating and such a huge challenge for all of us. And it's hard not to be afraid, not to be confused, and not to be paralyzed, because those are 3 things I think they most want any of us to be. And I think that's maybe what we all know in our work in sexual reproductive health and rights, that we can't be any of those 3 things. And but that's hard to not.
I super hear you. I super hear you. Esther, please.
Thank you so much, Sophia, and thanks for everyone being here and listening to us. Let me answer your questions in a more personal and a professional point of view. I was a Hungarian lawyer graduating from law school in 1997, just when communism, socialism was falling, and the very basis of democracy was introduced. The separation of power from the executive, from the judiciary, from the parliamentarian was introduced, free election, all of those institutions that we are very well connecting now to sexual and reproductive health and many public health issues that is dependent on that. And I experienced and contributed to how much time it takes actually build up these institutions to make people understand and exercise it, including in the healthcare, in the health system, in terms of patients' rights, in terms of sexual and reproductive rights. And I think what shocks me and horrifies me a lot, that the very country who introduced the democratic values that is also connected to sexual and reproductive health, not only in Eastern Europe, but many parts of the world, like these autocratic, totalitarian leaders can destroy it in days and weeks. And as a Hungarian, as someone who is out of the US, is just very horrifying. And in terms of as a chief executive of Sexual and Reproductive Matters and a sexual and reproductive health and rights lawyer, I think one of the shock, as Mitchell said, that we all knew about Project 2025, Protego 2025, the absolute disprofessionalism and ad hocness about the Geneva Consensus document. Exactly, we didn't expect that it can happen so brutally and so much disregard to humanity, to people's life, both in the US and globally. But I think what shocked me, I think many parts of it didn't shock me as much as the attack against science. I just didn't expect it in such a brutal way. And because experienced and through my grandparents, through my own life, it happened in Nazi Germany, it happened in communism, it's happening in Hungary, although I think Hungary is kind of a test playground and not even comparable what is happening in the US. And I think the not understanding by both the populations and the leader what it means, how it affects actually people's life and health, and how it is fundamental for our everyday life. I think this is the most pillar that I didn't expect and understand in such a massive way.
Totally. I super hear you, and I'm grateful to all of you for these responses. I think it orients us really well. Esther, can I stick with you though and just ask, let's take a step back, because there are many different ways of thinking about health and development efforts that impact SRHR, and like there's the local, there's the global. Are there dangers that you see to the continued existence of multilateral solutions to sexual and reproductive health and rights? When you think about the health and rights of so many around the world, thinking about the denial of funding to UNFPA, to UNAIDS, the withdrawal from WHO, how do you see multilateralism going forward? How about the role of governments, of civil society? I mean, I'm just thinking about, short-term, long-term strategies for trying to address this chaos, not just in the US, but at the global level in countries around the world. What do you have that you can help us to be able to start to think about this?
I have to be honest, Sophia, and we talked about it, that when you posed the question to me a couple of days ago, I had sleepless nights because I think we wish we would know the answer. And I talked to many people because I wanted to feel the atmosphere. And of course, everybody is scared that multilateralism and the UN, and in both at the global and regional level, might be falling. But I think it's very important to recognize, because I talked to why multilateralism is so important. It's 70 years, it took 70 years to build up very solid human rights systems, development system, the SDGs, economic collaboration. That has a direct impact on life and health and sexual and reproductive health. I mean, and it's being implemented in countries. Many countries in the global south, but around the world, build ministries, build governance, build civil societies, health system, delivery of services based on these multilateral solutions, collaboration, agreements. Whole accountability mechanism has been built when civil society, governments, each other can hold each other accountable. They are very important, and they are resulted very concrete results in reform of constitutions, development of laws on rape, on gender-based violence, on transgender people access to services, on FGM, on elimination of early marriage. It's very important to notice that more than 60 countries over the past 30 years liberalized abortions and made access to services that resulted in the reduction of maternal mortality and morbidity. And these countries are continue to do so. And this brutal withdrawal from the development system and attack against the multilateral institutions just has a huge impact. I do believe, and many of us believe, that the multilateral system continue to exist, but we cannot take it. I think we took them for granted, and we cannot take them for granted anymore. It's very clear that the multilateral system cannot depend only on a few countries. And there has to be a call and the structural reform for more diversified leadership in various forms. The relationship needs to be rebuilt, and it cannot be just dependent on the development of or the contribution of and the leadership of and manipulation of few countries. We need to be also opportunistic, because we know that governments are changing and take the opportunities when they occur. For example, Brazil and Mexico and other countries who are ready to defend sexual and reproductive health and rights, and look at the G20 countries who are upholding sexual and reproductive rights. We need structural changes, both in terms of governance and also at the technical functioning level, but it's possible to make those changes based on the values that these multilateral consensus documents, political declarations, human rights declarations, WHO scientific standards are built on. So we need to uphold them stronger than ever. And when it comes to civil society, I think, and I'm at the CSW PACE, and I can see that how it's already happening. So I was very depressed when I came to the US 2 days ago, and I'm more hopeful what I see, that how governments and civil society actually can work together. We need civil society to hold governments accountable, but also we need to look into civil society for solutions and bring the private sector as partners in a more visible and more structural and more functional way into the picture.
That's super helpful. That's super helpful. Thank you. You know, Sakai, let me turn to you, you know, and talk about Engender Health a little bit, because Engender Health has this commitment to advancing sexual and reproductive health and gender equality. You know, both of those are concepts the administration has brought into question. You talked about the shuttering of one program in particular, but can you talk about direct health impacts that you're seeing from these orders? What are you seeing in terms of research and development priorities more broadly? You know, and are you thinking, or are you rethinking how best to support the health and rights of the communities you work with? And I'm thinking across the very different areas where you work. And, you know, I know you have a specific commitment to working with young people and to vulnerable populations more broadly. So I wonder, in terms of young people and vulnerable populations, if you have anything you can give us in terms of kind of where things are moving.
Thank you. Yeah, the direct health impacts they are enormous following this the shutdown of our programs. It means thousands of people cannot access high quality SRHR or GBV or maternal health services that they were accessing in some of the most remote and limited resource settings that we can think of. Those same health facilities that we were supporting and the health providers that we were working with received substantial support from the foreign assistance. Health information systems were dependent on the support that we were giving through these projects. Our local partners that were serving the last mile in terms of community engagement, in terms of interactions and engagement with the young people, they now must figure out how they might have to continue providing the care that is required by the communities that they are working with. The commodities that were availed to these health facilities have been disrupted, and governments were not ready to pick up this, because we know quite a substantial proportion of budget support comes from foreign assistance. And the supportive supervision, for example, that health workers have to do in the communities can no longer happen, because the funding that they needed to do that is no longer available. For example, on our maternal health project that was working to support safe cesarean deliveries globally, we are going to miss an opportunity to save up to 260,000 women who could have benefited from safe cesarean deliveries and fistula repairs, because the project was prematurely terminated. We could have averted 23,000 abortions or 57,000 unintended pregnancies across the countries that we were serving. We could also have averted 64,000 child diarrhea cases or childhood illnesses among the newborn babies by availing timely treatments and immunizations. quality health service delivery by trained healthcare workers that we were training to provide quality care. And they are going to have stockouts of vital supplies that are required. The mobile outreach services that government was doing in partnership with our project teams in places like Ethiopia and some of the most remote pastoral communities that we're working with will not continue anymore. Regarding critical research, this funding allowed us to perform some of the most innovative and discover ways of providing services and understanding and learning from the communities that we're working with. And all that was suspended and terminated, and we are not going to recover the gains that we were going to realize from that. There's going to be potential delays in policy reforms within the governments that we're partnering with, or scaling back of domestic investments in family planning and reproductive health. You would understand that US government in general occupies a big seat in terms of messaging and setting the pace globally, and they will take cues from such a partner whenever significant changes like this are introduced. There's going to be a gap created by this change in priorities, because governments are now going to be forced to make hard decisions between health for their communities and other national priorities. We all understand that areas like security will take priority ahead of women's health in most of these context that we work in. You would find that in a situation like this, we can only hope that our local partners that we're working with and other stakeholders that we're partnering with will seek new ways of continuing the work and strengthening the work that we're doing. But as an organization, among a community of partners, we remind ourselves each time, and this is something I hope that we all share and understand. You mentioned earlier about the language that we use, which is now standing in question. Both at an individual level, institutional level, and policy level, we know that language alone can form attitudes that affect an entire community or society for generations to come. During a time when human rights of individuals with intersecting vulnerabilities in all their diversity is being questioned, we reaffirm our commitment to stand with disadvantaged sections of society to achieve gender equality, because we firmly believe that through gender equality, we'll be able to achieve universal health care for all people who need it. And through SRHR, it is one of those impactful areas that can help us achieve that.
Thank you. Thank you. And thank you also for those sobering numbers in terms of that you presented to us. You know, Francine, as long as the bandwidth works, I want to move into a conversation with you about access to abortion and contraception and reproductive justice. You know, it's not just about the changes you've seen or you anticipate, but when you think about the US populations you work with and the other populations that Plan C engages with across the world, you know, how are you thinking about what needs to be prioritized for abortion access specifically in the current moment? Here's hoping that you can talk.
I hope so too. And if just wave to me, Sophia, if it's not working. Okay. So, and I'll turn my video off if that helps, and then wave to me if it's still not working, and I'll shut up and you pass it to somebody else. Anyway, thank you for that. Honestly, the abortion issue, I think everything that I want to just reiterate, everything that Sakai Esther Mitchell has said. The best way to know what to do is to focus on what they're coming after. They're really good at figuring out what is the piece that endangers them. So the science that was mentioned, they're coming after science. They're coming after the community, the fact that we work together. They're trying to to stop the community, as Mitchell was saying, how important that is. They're coming after sexual and reproductive rights. That has been always, okay? We've had the US has been the worst leader in sexual and reproductive health when it comes to policy, because they knew that was a wedge. And then even the multilateralism, the best example is they're destroying in our own country. We're now pitted state to state. Forget country to country. They've literally are trying to divide us up so that, certain states can't do what, are criminalized for doing what something else in another state. So I guess the point is what we can do, and I see in the questions that are being asked, what is it we can do? We need to just stand stronger than ever in all of the principles that we've used and that we care about, because they have recognized that that is the power and they're trying to dismantle it. So continuing to work together, continuing to focus, as you said, Sakai, on now, we saw what happened with the Ukraine situation, NATO. It's like, okay, now we all have to gather together and not count on the US either funding or support or leadership or anything, because we now need to move forward with the strength of what we've created through the multi-sectoral, everything, and continue to do that, because the US is the right, this administration is pointing and showing the pieces that are what they need to have happen to become autocrats and to get rid of the democratic principles. And so they're showing us the way. And what we need to do is really fight on all of those levels, fight against the destruction of science, fight against for access to health care to everybody, fight on the human rights, fight and point out how egregious, nasty, brutal, mean, just keep pointing that out. I think this will it will help us continue to address the principles that we all hold as the principles. Sorry.
I know, I super hear you. I want to go back to like just your point about the what can be done. And Mitchell, I'm now going to turn to you, right? Because I want to move into a discussion of the ways in which organizations have been making their voices heard and responding to the executive orders, whether directly or indirectly related to sexual and reproductive health and rights. And, there are many different forms of response that are starting to happen. And the fact is AVAC has filed one of the 2 lawsuits to fight the administration's pause on foreign aid. Can I ask you to talk a little bit about what led you to file the suit, what's been happening with it, what you hope to accomplish? And if you could talk about that for a while, and then I'm going to ask you to close this intervention, if you would, with, what role, if any, do you see for partnerships playing across communities, back to our sense of community and across borders in the next few years? So Mitchell, if I can turn to you.
Great. Sophia, thank you. It's been, I feel like it's been a lifetime in the last 6 weeks. It's like dog years, but on steroids. It's hard to really imagine. And I will just say, and I can put a link on our AVAC website at avac.org. We've kind of provided a timeline of what's happened since the executive order. It's fascinating that one of the very first executive orders, as you named, almost 100 now, on January 20th, Inauguration Day, that evening, was the 90 days, quote unquote, pause and review of foreign assistance. It's interesting that became such a top priority. I believe part of that was because for all the work we do globally, not just HIV, but reproductive health, malaria, TB, there's not really a constituency in the United States for it. I mean, those of us that work in this space who are Americans, we're a constituency, but by and large, most Americans didn't know what USAID was before January 20th. Now, I think it's safe to say that everybody knows what it is, although most people don't understand what it is. So we had that January 20th. A few days later, Secretary Marco Rubio, who's actually been a pretty big supporter of foreign assistance in his career as a senator, clearly made a deal with the devil when he became Secretary of State and took the executive order and introduced draconian actions to enforce it, including immediate stop work orders across pretty much all of foreign assistance. And it sent a chilling effect. Now, AVAC is a very small advocacy organization relative to the larger foreign aid ecosystem. But one of our projects is funded by USAID, and it's actually about 40% of AVAC's budget. Most of the money actually goes to African civil society partners working around HIV prevention, research literacy, the idea of development of new technologies. So very niche. It's a niche of a niche of a niche of activity. But you know, in the classic tradition of ACT UP in AIDS response, you know, ACT UP, fight back. And the idea that that this was happening was anathema to all of us. And we began to talk very quickly with Public Citizen, which is a organization that does a lot of work around access to medicines. They also have a litigation group, and they were interested in filing a suit. They also filed a suit about the USAID workforce. But they were interested in filing a suit about foreign assistance. And what was really remarkable is that we could not find another plaintiff. And the lawyers wanted a second plaintiff because we get USAID funding, but the orders were not just about USAID, it was also about the State Department writ large. So to make the case broader, we wanted a State Department grant recipient as well as AVAC. And our board was supportive, although it did take a little convincing of why this was important. And of course, the first question that any board member asks is, why is no one else doing this? And I want to be clear, I'm not critical of any organization that has not sued. We assume, you know, and we work around equity. And if I'm ever asked to take equity off our website, I will say, take your money back. We are never not going to talk about transgender individuals. We're never not going to talk about reproductive health and sexual health and rights. And so we assume we're not going to get funded in this administration. So we kind of assumed we were going to lose the money anyway. So I was probably more cavalier than perhaps I should have been. So it wasn't that hard a decision. It wasn't as if we thought we were losing something because we felt we already lost the money. But we thought it was so important to raise the issue. And I'll be very honest, I don't expect we're ever going to get that grant back. So I've been asked, well, why would you sue if you don't expect to get it back? This is not about AVAC. This is not about USAID. This is about the rule of law. And again, I am not a lawyer, to be clear, but the reality is that what the administration has done is against the law. And we now have a whole public record to expose that, including a number of the real heroes here, not AVAC at all. The heroes are Judge Amir Ali, who's been incredibly bold and supportive, but more importantly, 7 different USAID staff who've been whistleblowers, 7 unnamed and anonymous, 1 named, who've come out to really expose the intentionality, to expose the way in which they are dismantling things. And Judge Ali actually has found now in multiple rulings that the administration has basically acted against the Constitution. The administration is basically saying that foreign policy only sits with the executive branch. And there was a hearing last week in district court, and it was kind of remarkable. The judge was asking the lawyer from the Department of Justice representing the State Department how he justifies that. And he mentioned the Constitution, and the guy was going on about how, the lawyer was going on about how the Constitution, Article 2 talks about foreign assistance being with the executive branch. And the judge said, I'm interested that you didn't mention Article 1. And then the judge said, I actually have the Constitution here with me. And he then read from Article 1 about the separation of power, about the fact that Congress has the power of the purse, and whether they are being usurped by the current administration or whether they are abdicating their role, or a combination of the two, as I think we all kind of assume, they're breaking the law. It's not going to bring USAID back. It's not going to restart the funding flow, but it is establishing a record of the willful, intentional dismantling of democracy. And I don't say that blithely, and I don't mean to say that, you know, one little court case is exposing that, but we are seeing a pattern across the board. And that's why we did this. And again, officially, as of Monday night, there is now an injunction against the State Department. They have to start paying their bills. But they can also start, and they already have over the last 3 weeks, as many of you know, and as Sakai described, they are terminating projects faster than anyone could have imagined. We believe that's actually illegal the way they're doing it. They're not actually reviewing projects. They are just wholesale dismantling things. And unfortunately, the ruling on Monday didn't stop that. We tried to get it to stop that, but you know, you don't win it all. So it's a very small step. It's not, I don't think it's a victory. I think it's a small step, and I think we've got a lot of steps to go forward. So in the last part of your question is, what can people do? I think people need to be aware and attentive to these issues, and whether it's taking legal action, whether it's focusing on doing work differently, whether it's focusing on things we need to stop doing or lean into things that we need to do more of. I don't think there's any one way to do it. I think the most important thing is that there are a lot of crises right now. And I do feel that we've spent, all of us, the 6 weeks, including us in the lawsuit, of kind of plugging the holes in the dike. But the holes have come fast and furiously, and they're getting bigger and bigger. And I hate to say this, but I actually think the dike is never going to be rebuilt. I think we collectively, particularly in SRHR collaborations, need to go upstream and build an entirely new dike. I think we need a totally different way of thinking, and it's hard. I'm sitting here at a conference of, retroviruses and opportunistic infections, a big scientific meeting, and a lot of people are trying to go back to January 19th. I think we need to go forward. I think we need to design something radically different. I think we need to be, we talk a lot about the localization agenda, transitioning all types of work to national partners. That was already happening. I think we need to do it in an accelerated fashion. Everything we did before was precursor, but we need to think differently. And that's hard, particularly when this onslaught of crisis comes. But, that's why we sued. And there's just so much more work to do. It's not a law. It's not a court case. It's a movement that we need to create, not just recreate, but create new.
Yeah, I super hear you. I think everybody does. I just, there is this moment, there's like these ever-changing realities in terms of global politics, in terms of the national politics, but the issue really becomes, how can our work continue to positively impact the health and rights of the populations that we serve, right? And I think my question, I mean, maybe it's because I'm living in California now, but I want to say something about, we have to figure out also how, as individuals, to make sure that we're not overwhelmed, but can think strategically about what's needed and can, get that sense of community from one another. But more than anything, it's about, how are people taking care of themselves? I really want to spend a moment on that. And I'd like to kind of go around and ask each of you about that, because I think that that's really something that we can learn from. Just looking at my screen, Esther, do you mind if I start with you?
Yeah, again, for me, I'm living a time when I'm very personal and professional. I mean, personally, I think my family, love, community, very much helping. On the other hand, exactly the partnerships that we always thought that partnerships and partnering takes a lot of time, and I think it can happen very quickly as well in different forms. And I just would like to recognize the audience as well, like Caroline Kabiru, for example, who from the African Research Center is asking that could this be an opportunity to enhance domestic financing for SRHR and health more broadly? So many conversations is happening around it. This, for example, this initiative, people would think that it's unfair on government who don't have the resources, but this is exactly when partnerships could be created and revitalize us in terms of doing something differently. Someone is asking that what public health students can do in this, and I recognize that probably, Sofia, many of your students. I mean, also thinking about how many times in history in different parts of the world, students' demands created revolutions and fight back. We are doing a lot of dialogue meetings, and one of them, and we are short in time, but the executive orders on protecting women from gender ideology, I think it's so illustrative what is happening. And we just had a brainstorming meeting on Monday. It's illustrative in a sense that protecting women, we never asked to protect us from trans people, but this protectionist approach, it's a kind of, it creates anger, it creates this revokes this misogyny, and it helps actually to know to it, but it also reminds us that how always finding the scapegoat, whether it's the Jews, the police, like whoever, now the transgender people for elimination, makes us angry. And sometimes anger helps us to fight back, because it's so unacceptable that we need to organize, and not in a way, I think we were a little bit slow in the past 30 years. We need to do it in weeks now to reorganize, exactly as Mitchell said, and build partnership and show yeah, act together.
And so thank you. Thank you for that. So yes, it's that combination of the personal and the professional, basically, is what I'm asking. Sakai, can I turn to you next on this?
Thank you. I would want to admit that feeling overwhelmed is quite normal in this situation. And I think the entire global health community is overwhelmed, and it's quite normal to admit that that's where we are. But we want to quickly pivot and look into the future, as Michelle said, adopt a mindset that helps us focus on the people who need our support more, adopt a growth mindset. There's always a future. The sun will surely rise again tomorrow. And improve our systems, improve our approaches, look into new alliances, tap into new sources of funding, look more into that domestic financing space, cultivate local philanthropies in the countries where we operate. Yes, big money is always helpful. It helped us do more. It helped us push those heavy weights. But even with little funding, there's a lot that we can do, especially if we root our work in locally led development. Again, as Michelle mentioned, USA themselves, they championed localization. This is the time to put that to the test. With less funding than we did before, we can do so much through local organizations. We can do so much through those partnerships with youth-led organizations that only need a little bit of money to stay connected to the internet, to be able to engage in conversations like this through internet. That sometimes that's all they need. They probably just need space to work from so that they can connect on the internet and join meetings online and participate and share their experiences. Let us look into those spaces whilst we continue to devise other ways of working in this space. Both internal and external conversations are very necessary than keeping to your own space and wallowing in the misery that this is bringing to everyone. So engaging and listening and sharing our experiences is very important at a time like this. Again, reminding ourselves of the principles and the bigger goals that we are all aiming to achieve. Let's not lose focus of why we are in this work in the first place. We are doing this because we believe in a higher cause than just a big budget, annual budget that is coming from a major funder, like you said. And let's remind ourselves again, it's not only US government that has pulled back. We are aware that 3 of the major donors in our SRHR space includes the FCDO and the Dutch government as well, each carrying 13% and 17% of global family planning program and reproductive health activities. Similar to USAID, they've pulled back and they've promised that they're going to do so in a significant way. So what are we going to do? Because already family planning budget was a small component in proportion to the global health budget. Now that the 3 major donors have announced that they are going to pull back, and one has already done so in a drastic manner, we need to take this reality and engage with our partners in the countries where we are working in a different way than we did before. I'm sure they are also grappling with the same questions. If they were depending on the basket funding that was coming from these donors, now they have to figure out how to do it differently, how to reprioritize, and how to partner differently and engage differently to serve their own people. And we need to be there as their partners to continue supporting the work.
100%, 100%. Francine, can you take it from there?
Yes, I'm happy to take it from here. There's so much we can do. There's just data out from Guttmacher last week. Since Dobbs, since we lost Roe in the United States, there have been more abortions in this country than there were before. Why? Because there's a new option. And the most important thing everyone can do to feel like when you get up in the morning, there's something I can do in the US that is transformative is buy pills online, send them to everybody, tell everybody they have options, share the word, share them information. It was done differently. We had to do it differently. It was about movement building. It was about using a little technology that they tried to, restrict because it was so transformative. It's about putting agency in people's hands and taking it away from the government, away from providers, away from systems. That's what's happened with medication abortion in the US. And it was based on what we learned from the international, who had to do that even earlier because there were not enough services around. So yes, there's a silver lining here, which is, push against the establishment that wants you to do it one way and put the agency of being able to make a decision about whether or not you want to continue a pregnancy or not in the hands of those who need it by buying pills. It's legal. You can go online. You can do it. They can't come and get you. And share it, distribute it, put it where it should have been in the first place, which is over the counter, had we been based on evidence instead of politics. You can do this, and we need everybody. That's the movement. Step up, do it, send it, give it, tell people about it, destigmatize it, normalize it. And that's just a small piece, but it goes straight to the heart of what they're trying to do, which is to take our autonomy away from us.
I hear you, Mitchell. Mitchell, please.
I just was shaking my head violently, Francine. What you said is, I couldn't say it better. I mean, we just can't be paralyzed. There's so many things that we need to do, and the old saying, living well is the best revenge. Doing our work well is the best revenge. And I get it. And I we've laid off a third of our staff. Every organization is going to be gutted on some level. So it's easy to say, do our work well. It's going to be really hard to do our work well. I think we need to figure out what we don't do, each of us, what we do differently and better together. And, the rising tide was lifting all our boats. There's been a lot of money in the last 20 years for our collective field, and there's going to be a lot less. And this is one of our biggest risks. Will the HIV people fight with the reproductive health people, with the TB people? Yeah, they probably will. If we're left to our own devices, we need to be smarter. I mean, one of the things that is, I think Esther described it. If you look at what the opposition has done, is that there was a huge, frankly, fascist command post that said this: you will all think the same thing. None of us in our world want to live in that kind of environment. But if we're going to build for the future, we do need to put some typical ways of working aside, and we're going to have to give up some things. And it's hard because we're used to wanting it all. That's what we do in progressive movements. We fight for it all. And I'm not at all suggesting we compromise on principle. I think we need to collectively define what our principles are and then operationalize them in a different way than we've ever done it before. They can take our money away. They can take our voices away. They can try to take our voices away. But we have to fight against that. And again, it's easy to say, and I realize how complicated it's going to be. But I think that to me is the challenge that we need to step up for. And I think we can do it. And that's funny. And one thing I'll say that's perhaps the most depressing. I've been in a lot of meetings the last 6 weeks where people said, "Oh, we've been through X before. We've been through budget cuts. We have never been through this before." Unless you grew up in 1930s Germany, as far as I can tell, as someone who didn't study science, but studied English history and women's studies. Unless you lived in 1930s Germany, you've not been through this before. So we actually don't know exactly what to do. And so we've got to dig deep. And when people say, "Oh, well, we did this last time," well, there was no last time in our world, and we need to step it up.
So let me take that if I can, and just say, yeah, we don't know what to do, right? But I'd like to give each of you 2 minutes just to close us out, really, to give us your vision, your strategy of how are we going to get to the other side, right? Moving forward based upon all the things we've talked about in this last hour together. Is there one action, one idea that you can think of to support sexual and reproductive health and rights that can help to move us forward? And you're not being held to this. It's much more just to help us move forward in terms of being able to think. Mitchell, do you mind if I start with you? Because you were just the last person talking. So just
Sure, and I've probably spoken too much, so I'll try not to use 2 minutes. I think what we each need to do in our organizations and in our communities and in our kind of collective strategies is to define what we need to stop doing. And it's the hardest part. I had a board member years ago at AVAC who, when I would present the budget, she would say, what if you only have half that budget? Go back and tell me what your priorities are. And then I would do that and she'd say, it was kind of like a game. And then she'd say, okay, now you know what's important. So since you know you're going to get the whole budget, don't do all the things you were going to do. Double down on the things that you said were your priorities. And none of us are, I know I'm not particularly good at that. I'll use an I statement. I'm not particularly good at that. We need to rapidly say, what have we been doing that may not be absolutely mission critical? And then even if resources do begin to come back, don't just automatically start funding the things that we cut. We will know in that process what was the most important thing in the short term. And in the longer term, it's going to be more of that, not little bits of everything. So having some discipline of what not to do may be the most important thing we each do, and put that together into a comprehensive strategy. And the one other thing is look for unlikely allies. I think we live in an ecosystem where we know we work with our friends. Sophia, let's face it, you invited me because we're friends, and I appreciate that. And I'll never say no, but we need to start looking at some very different kind of alliances and new collaborations.
Totally. Francine, can I turn to you?
Thank you. I'm happy to follow up on that, because I totally agree with the bit about working with different allies, with the community part. The community part is the part that I think is the most critical. And the community being larger than our sort of, we've been forced into these silos that we know from way back. So back to, it kind of goes against or even makes more challenging your very good point, Mitchell, of narrowing and being more efficient. But at the same time, if I really, really believe that the only way we're going to get all of this is to continue to lift all boats, is to continue to realize that the reason I'm reacting to the horror of what's being done for gender affirming care as an abortion rights person, why am I reacting to that? It's because there's a very common principle that is being attacked. So I do believe we need to stay with our principles and have more partners.
Thank you. Esther, can I turn to you next?
I don't have a solution, but I would like to recommend one thing to do, that please read the publication of the European Parliamentary Forum, APF, and Neil Data and colleagues reading. It really energized me. It's about Beyond the Chaos, a New World is Emerging. That is really helping us to move forward. At least it helped me a lot, and I talked many colleagues about it. Describe the situation in 3 phases, and the last phase that I can resonate with is about the creation of an alternative global framework for action, safeguarding the gates of progress in SRHR and countering the precocious state of democratic institutions. It's about discover and document what is happening, and disarm, engage, apply the lessons learned, dislocate and develop measures to counteract, demonetize, fund, so it's for our funders as well, and defend and preserve and reinforce. So I really like this framework. So if you need good energy, please go to this publication. It was a free advertisement, but it touched me very much.
Thanks. Sakai, before I turn to you, I will say that Esther will give us the citation, and then what we'll do is we'll include it when we send out the recording to everybody. Okay. Sakai, please close us out.
Yes, I would say integrate SRHR work into other sectors, working at the intersections, and so that we can truly walk the talk on how fundamental SRHR is to achieving other development goals, and mainstream it into other spheres of human interactions to ensure that rights are upheld and health is supported for everyone, everywhere. Let's resist regression, and let us ensure SRHR advancements are preserved and expanded. Thank you.
Thank you. And look, I mean, Thank you to our amazing panelists for this incredibly thought-provoking discussion. I really do feel like we could keep going on. And I want to thank everybody here for coming to today's event. You know, SRHM did a wonderful webinar a few weeks ago, and we're building on that. And there are more and more of these types of conversations happening these days, coming back to the point about community and hearing from one another. I really look forward to other opportunities for us to learn from one another. We're all trying to make sense of how best to engage in this world we're living in right now. Hopefully these kinds of conversations can help to do that, just to share that this is our next event, but really just thank you everybody for coming together. I really appreciated the conversation very, very much.